And I think that's what medicine has gotten away from. We've gotten away from pathophysiology and understanding the molecular science, of how the body works. I 100% believe that God gave us everything we need on this green earth to heal the body. And so, we become disillusioned with, going to the doctor and, I have a cold, I have an ache, I have a pain, I have inflammation. And the doctor has 5 minutes to spend with you, gets out his prescription pad, and your symptoms are decreased. But is that a fix or is that just symptom relief? Right. And so with this, for lack of a better word, brainwashing that we've kind of gone through, this evolution of change in the healthcare system, trying to go back to the basics is really hard to undo some of that.
Welcome to Ultra Life Today. We have a really interesting show for you. Adam Payne, by the way.
Hey.
What's up? I love to bring local people into the mix that I think are really important to the community, that are really important to bringing health to people on a local level. And so
I think you need to introduce her.
Without any further ado, Tiffany Richey, welcome to Ultra Life Today.
Thank you. I appreciate it.
I'm really excited about having her here.
So I've got to share a little bit of a anecdote. I actually know Tiffany's mother-in-law who did the most beautiful watercolor for one of my babies when they were born.
What? That's such a random connection.
Oh, yeah. And I swear, if she had a website, I would announce it because she does watercolors that are brilliant, especially of children and babies.
Is she still doing that?
She actually is. She was hired recently from someone to do the exact same thing. Yeah.
Wow.
So not surprised.
That's a rare. Watercolors, I think, are just a rare talent.
So we met Tiffany through Keith Bishop at one of the original health meetups almost 7.5 years ago.
Oh my gosh.
Can you believe
was
it's that long? And
really?
You look really young. You look older. I look older. So
there's something to this anti-aging stuff.
Yeah.
We like what you're doing. You're going to tell us about that. So Tiffany, give us a little bit of your background, your street cred, your credentials, and what you do here in Oklahoma City.
So I started studying functional medicine about, like you said, 8-9 years ago. I started as an ICU nurse and saw there's a big disconnect in, lifestyle and diet and what's happening in the population. And so I got an opportunity to follow another provider here in the city, which was incredible, and learned that there are alternative ways to treating health.
Did you... You almost make that sound like it was an accident that you.
It kind of was, kind of wasn't.
Tell me about that.
Yeah. So, and my mother-in-law, who is a very precious human being. Her daughter, so my sister-in-law, at the age of 20, was diagnosed with a neural autoimmune disease.
Oh wow!
And she had 30% atrophy of her cerebellum, lost her ability to walk, and has some Parkinsonian symptoms, MS symptoms, and, was misdiagnosed because of the inability for coordination. And so was passed through the traditional trajectory, through the Mayo Clinic, all these places, and, basically is on symptomatic treatment. And so, I knew there had to be something else. I've always been interested in medicine, but, when you're in the system, you don't realize that there's something outside of the system. Yes, you get the tunnel vision.
Yeah.
We call it looking
Standard
through binoculars.
Of care, right?
Yes, binoculars through the opposite lens, if you will. And so there was something always tugging at me. And when I was in the ICU, I knew I didn't want to be in that system anymore. And so I thought, well, let's take it a step further where I feel like I have more participation, making decisions in patients' life. And that's when I decided to go further into the nurse practitioner. But then during my clinical rounds, I was following colds and flus. And I remember going into a patient, because we learn in nursing school to take care of the patient through lifestyle and diet. But when you get out in the real world, you don't get to hear it very much. So I was going back into the patient's rooms with my preceptor at the time. And we were talking to a diabetic patient. And I said, well, I want to teach him about diet. And so I went in there and, I was gung-ho. I had all of the reducing the carbs, the macros, all of the things. And we walked out and he was like, that was great. But, he's not going to go home and do that. So next time, maybe just instead of telling him to eat a whole other food other than the pizza, maybe take one topping off the pizza, start there, and it was a little discouraging to see.
I was going to say, are you a tough woman? Because that first experience, getting out there and saying, hey, this is it, and having all the people working around you go,
yeah,
don't share that.
Well, it's like, don't waste your time, right?
Yeah, don't waste your time because he's not going to listen. Well, how much opportunity has he been given to listen? I mean, I didn't know that patient. Maybe he had a much longer history with him, if truth
maybe,
be known,
but some of these people, they've never heard this information.
No.
And so somebody like you coming in saying, hey, I have a path to wellness for you. Some people are going to take hold of that. There's a certain percentage of people that are out there that are just sick and tired of kind of being stuck in diabetes or in whatever inflammation syndrome that they got going on. It's just they don't see a way out, and they need an intervention,
They do.
like a comprehensive metabolic intervention, like different food, different exercise, and stuff like that. They just don't know what to do.
Right.
And then they maybe attach themselves to like an app on their phone or some like weird diet that they subscribe to. You've seen it.
I do. And it's hard when you're in this community because there's all kinds of wellness out there. And I still get bombarded with the calories in, calories out situation. And I come in, no, it's inflammation in, inflammation out. It's not that simple. There's hormones involved. There's a whole endocrine system that you're ignoring. There's underlying inflammation. There's environmental triggers. And so, unless the patient is willing and wants to make some disciplinary changes, you're going to fall right back into old patterns.
So this may be a tough question for you, or maybe not, but rewind 8 years ago when you started doing this. What were your expectations as it relates to your typical patient? I mean, obviously your heart has this compassionate note to it, your family member with this horrible neurodegenerative disease. Did they ever give a name to the disease or what was going on?
They said something like it was a neural Hashimoto's.
Oh wow!
Yeah, there was really no name for it.
But it was simply an autoimmune condition.
An autoimmune condition
attacking the brain tissue.
Right.
Wow.
Right, and eventually, they put her on enough steroids and maybe methotrexate. I don't remember what drug they put her on to kind of to stop the process of it. But what was her quality of life after that?
Meh. Yeah. Sorry, Josh.
No worries,
I derailed
brother.
the direction you're going in.
No, and that's okay because you yourself have a really difficult thing that you deal with on a daily basis. So when she mentioned her relative, I saw your radar just go up.
Yeah, well, I mean, there's so many people that deal with Hashimoto's or these other autoimmune conditions, and we have so many challenges in our community. Not only is I think there's a rise in these autoimmune diseases, but we've been seeing just a lot of cancer happening in the last year. And I don't know if we want to touch on that. It's kind of a, it's a story. It's a topic.
I do want to bring that back around in a little bit, but I have to go back 8 years ago when you were just getting into this, Tiffany. What were your expectations for seeing a patient and how you were going to take them through your process versus now? Because you've learned a lot.
I have
and you've
learned
been
a
in
lot.
so many learning settings over the years.
A lot of trial and error, and it's sometimes hard to not get discouraged or calloused to what you're really trying to do, which is teach the basics again. And I think that's what medicine has gotten away from. We've gotten away from pathophysiology and understanding the molecular science, of how the body works. I 100% believe that God gave us everything we need on this green earth to heal the body. And so, we become disillusioned with, going to the doctor and, I have a cold, I have an ache, I have a pain, I have inflammation. and the doctor has 5 minutes to spend with you, gets out his prescription pad, and your symptoms are decreased. But is that a fix, or is that just symptom relief?
Right.
And so with this, for lack of a better word, brainwashing that we've kind of gone through, this evolution of change in the healthcare system, trying to go back to the basics is really hard to undo some of that.
The tripod of the integrative physician
Right.
is like nothing. We have 8 pillars. And so Vargas was like going, so where do you go?
I have 5.
5? Okay.
Yeah, so I'm a little bit, and you could probably make 100 if you really wanted to.
Are these 5 that you've come up with? Or
5 that I've
Adopted?
Okay,
yes.
I'm really curious.
Yes. So, well, first we see the patient, do a consultation, and I will tell you that I think, so when you're talking about your tricks in your tool bag, like the first is listening to your patient. So one, you have to hear what they have to say, and most of the time they're going to tell you. They know why they're sick. They know when it started. So listening to that and making sure that you're paying attention, because most of the time there's
a lot of physicians don't look at that, don't care.
No, because it's about the diagnosis.
Right. You're right. Yeah.
It's about the diagnosis. Because once you get a diagnosis.
The ICD-9 code.
Yes,
right.
there's an ICD-9 code that then gives us a treatment plan.
Yeah,
right?
understood.
So we listen to our patients, and then when they come back, we have an hour-long lab review. So an hour-long consultation.
Hour? Wow.
Mm-hmm. And then an hour-long lab review.
Ooh, they actually get to know you, don't they? That's
They do.
crazy.
That can be fortunate, unfortunate. In fact, one of my patients,
I think it's a good thing.
I told her what I was doing today, so I was a little bit nervous. She goes, Tiffany, just don't cuss and be professional. And I was like, okay. So apparently I've got a little bit of a, yeah.
You and my wife would get along.
You got some
A little bit. Well, when I get excited about things, sometimes I get a little passionate.
That's okay.
Expletives. I like that.
You're our kind of person.
A little bit.
Yeah, we get that way.
But on the lab review, I try to teach them about, what their body needs to function appropriately. And my 5 pillars of inflammation. So we're talking about.
So this is good. We've got a couple of minutes left in this segment. So give us your 5.
Yes.
And then we'll move into the next one.
So the toxic burden is what we're always looking at, and decreasing the inflammation burden on the body, because we know that we're burdened every day. So these are the things that I want patients to evaluate when they go home. Number 1 is always diet. What we put in our body is what we get out. Number 2, and none of these are in any specific order, just, what I've done.
No, these are good.
Environment, the things that we're exposed to. Are we being exposed to
toxic mold,
all of the things.
Parasites, all the good stuff.
Yes. Number 3 is stress, and I always tell them that's the number 1 underestimated toxin
That's a
on
good
the body.
one.
That's awesome.
Because,
it does affect people.
PTSD, all of the things, the chemical cascade that happens from the
Am I allowed to do this?
Trauma?
Yes, please do.
What are you doing,
We
Josh?
all need to be doing
Deep breathing, Wim Hof method. Let's do this.
All right.
Sleep, obviously, that's when our body resets, recovers, and regenerates.
And then number 5 is genetics.
Interesting. So that's like kind of the background milieu on which we have.
My platform.
The palette.
Yes.
And
Yeah.
before we go to this break, with 25 seconds left in this segment, I got to ask you, you mentioned genetics as number 5. Do you almost feel, because Adam and I have adopted some philosophies related to a lot of diseases being metabolic in nature, do you put genetics kind of way back there?
I used to, but it's coming more to
it
the
is.
forefront.
Okay.
Yes. Yeah.
Well, we'll talk about this in the next segment. This is Ultra Life Today. I'm Josh Bellieu. Adam Payne sitting over here, the CEO of Ultra Botanica, lead inventor of our patented technology. We have Tiffany Richey right in the middle. We're not letting her escape.
It's so
she's
grateful.
Gonna give us, she's going to give us some great information in our next segment.
Our mission is to take nature's most beloved botanicals and enhance them with our liquid protein scaffold technology. This helps it reach your cells faster and better. With exponentially enhanced bioavailability, you'll feel better every day. Ultra Botanica, the feel-good curcumin.
Hey, it's Ultra Life Today. Welcome back. Thanks for hanging with us today. We've got a really cool guest, Tiffany Richey, nurse practitioner here in Oklahoma City, Oklahoma. And I'm hanging out with this guy in the lab coat.
Yeah, Adam Payne here, and chief inventor of the UltraCure technology. And I am so grateful, Tiffany, that you're joining us. Josh, where were we going? You have a plan here. You want to take us on a journey.
Now, yeah, we're gonna go in this segment and continue to talk about Tiffany's patient process, but then we're going to introduce a 4-letter acronym, CIRS, that I had never heard of until Tiffany and I were talking. And she said, chronic inflammatory response syndrome.
Ooh.
And it so ties into everything she was talking about in her 5 points, environmental exposure, toxins, things like that. So we're going to get there. I don't want to go there yet, but we're going to dial into that later. Let's it seems like there's a new disease invented every minute, Tiffany, right?
I agree.
Anyway, so you were moving into your 5 points. You'd covered a couple of things with us.
Genetics being the last.
Genetics being the last. When somebody comes to see you, what's the first thing you do? And I know you listen, and that's the coolest thing ever, that you literally sit and listen to a history.
Yes, we do. And I have I'm sure they don't appreciate my questionnaire process, but there's quite a few questionnaires that they fill out prior to coming to see me. And then we look through those, and that kind of help guides the conversation, of what their chief complaints are and where they could have possibly accrued these problems over and inflammatory triggers over their lifespan.
So so these manifestations of illness don't just come out of the blue. There's
not
a whole number of factors that manifest. That's so true.
Yeah, most of the time. Now, I mean, there are certain situations like Lyme, for example, they get a tick and get the disease. But most of the time, it's a slow progress until they wake up and they're exactly like you said, I'm sick and tired of being sick and tired.
Yep.
And they decide that this is not the way that life was supposed to be. And their fear of what that future looks like sometimes brings them in or looks for alternative ways of dealing with it.
Typically, it's the general practitioners failed them, or even a specialist. They're getting into a narrow trough of here's your steroids, or here's your opiates, or here's your other disease-modifying anti-rheumatic drug, and it just doesn't do it. Right. That's treating a mechanism of a disease, but not necessarily getting at the
root cause.
The root cause. Yeah. So you're offering people hope. I
hope so. I really do. And that was a fear of mine when I first started was, is this really going to work? Because I'm a skeptic at heart,
Are you surprised like we are sometimes?
Yes, absolutely.
Yeah. I can't tell you how many times early on in the days of Ultra, we would have people call us and say, wow, I don't have knee pain anymore. Or, my dog, we were going to take him to that last, ride to the vet, and they're up and running around with the other pets. And, I would be like astonished, kind of like, wow, it's working. It's still working.
It's still working.
It's still. I mean, these are kind of not miraculous. Some of them are kind of miraculous.
Very much.
Yeah, I mean, but it's. I still get. I know the power of the LPS technology, the stuff that we've created, but we're not in the front lines. Dealing with the patients on a daily basis.
I'll tell you, I have a patient that stands out in my mind, and it was one of my first patients.
I was so hoping you were going to give us a use case just now, because I was going to ask.
I will, because she took it, and I think you might even know her, but she started with me. She had gone the traditional route, had open heart surgery, had been diagnosed. I believe, it's been years ago now, but some sort of arthritis, and just her quality of life was going down, down, down. And she had not heard about CBD, much about it. And so I put her on the Ultra Hemp. And she, along with dietary changes, lifestyle changes, getting her nutrients balanced, she believed that product changed and saved her life. In fact, I think you all have met with her, but she has her own facility now where she's teaching health and wellness in other parts of the state. And I'm just so proud of her because, I'd like to think I had a little something,
of course,
to do with it. But what gives me so much thing, and they start learning and taking the ball and going much further. But she took it even further than any of my other patients have by, starting her own CBD.
So rewinding
Yeah,
the tape.
that's a big step.
Rewinding the tape, when we first started talking today, you mentioned hormones and hormone replacement therapy. Can I call it HRT? Is that okay?
Yeah.
So what happens when someone shows up, a male or a female, and I guess you have a sense almost at times that that's probably what the problem is, but you have to do some diagnostic testing,
You do.
right?
So we do lots of testing at that first appointment. So we listen to them, and then the last part, they go to the lab, and we do a lot of testing. Now, sometimes, because it is such overwhelming material, sometimes I want to do a stool test, or I want to check organic acids, or I want to do those
and that
things.
scares the life out of people that have only gone to conventional doctors, right?
So
it's like a friend of a friend told me about Tiffany, and so
Yes.
she's going to ask for a stool test.
yes,
And
Organic
cleaning
acids.
your poop is always fun.
Right.
But, giving them little bites at a time and helping guide them through it. But we still, even with my smaller baseline panels, they're much more comprehensive than what we've seen in the past, with checking a thyroid, for example. We're used to looking at the TSH because that's what we're taught in school. That's how we learn to diagnose hypothyroidism. But we know that
And
thyroid
it
is a
completely neglects other panels that
Right.
need to be done, right?
Other panels
Yep.
and other parts of the thyroid where there may be issues. And so, like you said, the patient will be referred from another patient, and will you put them on thyroid? And so I know my thyroid must be off, but when you can look at it from a bird's eye view comprehensively, you can see, well, it's not just this, that we've got XYZ that's also contributing to the problem.
So the picture is bigger than
much
just
bigger.
the thyroid.
We're not
Right.
hyper-focused.
Right.
Yeah.
We're not fixing. We're looking at a patient who has a thyroid that might be out of balance or could be out of balance, but there are other contributing factors
Right.
that lead up to this. Your five pillars, right? So, give us an example. I mean, we have the CBD example or the hemp gal. How profound are the transformations that you're seeing? Are people making big jumps, or do you see people making little jumps? I can imagine some people. There are a lot of people that go gung ho and they come and they're like, "Oh, we're gonna change the world," and then where are they? They fall off the face of the earth sometimes. But what's the typical experience that people are getting, Tiffany?
Well, I would say that, one, it depends on the patient.
Sure.
Their knowledge base, which is why I think education is the most important, in educating them as best that I can on what's
So that's
going
why
on
you're
with their
spending
body.
time with them.
Yes.
Yeah.
And I wish I had 3 hours with them because I could talk the entire time for 3 hours. I talk very fast in the appointments to try to get through every single body process that I'm looking at, because I
Wow.
don't just go over the things that are out of order or imbalanced. I go over everything.
Wow.
So, and I tell them there are things that in this labs that do look good, but I'm still going to teach you about the process of dysfunction in this body system because you're doing something right. And I want you to keep doing that thing right.
Oh, that's interesting.
So we are preventative because it's much better to be proactive than reactive.
My wife is a PA, right? And one of the things that she tells me about the difference between getting into your 5-minute doctor visit to an intervention with a nurse practitioner or a PA is, she says, we do a better job. We do a better job because we really get interested in the patient, and we're doing a comprehensive walkthrough with them. Are your patients surprised
Yes.
at the amount of time that you're spending with them?
I would say I've not had anybody not be surprised.
Yeah.
They probably wanted to leave long before, and they're like,
But
really? Are
I
we
just
still
would
going to
not
do this?
shut up. They're
Right.
like, and sometimes they roll, okay, I get it, because I do repeat myself a lot.
That's good.
Yeah, intentionally. I
Now-
mean, the more they hear it, the more it's going to stay.
And do they get like a plan when they come back?
Oh yes, they get
It's
a
like, here's the
big
thing.
folder with all
my gosh.
big folder with all handouts that I've created to help reinforce and help them implement some of the things we're
One
they're
of
gonna
my-
You
come up
know,
with.
the organic acid thing, I think, we know Dr. Deanna Wyndham? Have you met her? Oh, boy, you're in for a treat. She moved here from, I think, California.
Newport Beach.
Oh yeah, the Whitaker Clinic. Yep. She worked for 20 plus years.
Whitaker for 14 years.
Yeah, and now she's practicing here in Oklahoma. And you're talking her language, organic acids.
Yeah, her top 3 tests, and one of them is organic acids. So she said the environmental toxins, the mold exposure is so off the charts.
And you're not going to see it.
Yeah.
But do you see it in the organic acids?
Yes.
Can you help us understand? Because I think it's important for our listeners to really understand what is an organic acid test and what kind of insights the practitioner can get from that.
So an organic acid test is a urine test that looks at the byproducts of some of the metabolic activities that's going on in the body. So if you have an overgrowth of yeast or mold, you're going to see the residual byproduct of that in the urine. So you're not directly testing the mold or the yeast.
But you're seeing those metabolic byproducts there.
Exactly. And so the higher the value, the more likely they have a systemic problem.
Are these things really visible?
How common is that? I have to ask. If you have 10 patients and you do an organic acids test, how many of them are going to actually have a struggle there?
So here's the thing. Okay, so
here we go. Here we go.
So there are some functional physicians out there. Amy Myers, for example, who I have great respect for. She's someone I followed and learned from.
She's not local.
No, she's in Austin, Texas.
Austin, okay. I'd never heard the name.
But when someone comes to see her, and this is, what I've heard through the grapevine, because one of my other friends used to work for her, but she said that every patient that went through her practice had to do all of these tests before they even got to meet with her.
Wow.
So they already came with an organic acid test, a stool test, all of the food tests, things like that. So I do things a little bit differently because I don't see any need to do a test that the patient may not find value in.
Awesome.
So I cherry pick those patients depending on, do they struggle with what I suspect to be.
Do you learn a lot from your
yeast.
questionnaires that allows you to make a decision about the testing you want to do?
Absolutely.
Okay.
That's why sometimes at that initial appointment, in my mind, I want to do a stool test or an organic acid test. And I know at some point I will eventually recommend it, but I may not recommend all of them at the same time.
I'm sure you're thinking, we can learn so much about what's going on here.
If we could do it all.
Right.
But who has the time? And a lot of,
And there's out-of-pocket expense,
exactly,
too.
and that's exactly what I was going to say.
World.
Well, in
this world,
Austin,
it's not that big of a deal. Oh, come on.
Well, it isn't to those of us that value our health, right? Health and wellness. We would spend all kinds of money to find out what is wrong.
Especially if we can get real, concrete insights about what's going on with me or with,
the evidence.
Yeah.
Right. But if you have someone who's used to having everything run through insurance and these labs are not covered by insurance, then they may say, well, let's do that next time. Or
dang you, insurance.
Once again. But I would say, back to your question, is that I do see a lot of yeast overgrowth. I do see a lot of mold overgrowth in the patients that I test for.
It is Oklahoma.
It is Oklahoma.
Is most of that related to diet, or is a lot of that these days? We're learning more and more because of my own bad experience with mold exposure because of a water event in a home I lived in.
Josh, you were toxic.
So all of a sudden,
I mean, literally, this guy went from healthy, robust, vibrant to on the couch with excruciating headaches week after week after week.
Yeah.
Long time.
Yeah.
And it was so crazy. And yet,
I thought Josh, honestly,
so many people,
I thought you were dying from cancer or something like that. Literally, you were sick. You had these awful, prolonged illnesses, and it was mold.
Yeah.
Did anybody ever tell you that it wasn't mold, that's just...
Well,
that's voodoo.
Now this is going to get into a weird place with me because
the tables
I trust
have turned.
myself more than I do practitioners. Although now that I've met so many good practitioners like yourself, I do go see a couple of those. I see Brian Frank, and he will order these tests that give me real insight into my health.
How long, John? I know we weren't planning on going down Josh was toxic with black mold. But how long did it take for you to get a recovery plan?
Well, Adam, I want to say something here, and that's where I was going with Tiffany. Tiffany, I really believe that so many people are being exposed to mold, even within their homes or their work environments, and they have no clue that they're being exposed. More family members I meet after what I went through, I can almost say, yep, you've been exposed, you've been exposed. Do you think, am I wrong?
No, I think a lot of people want that diagnosis, and when you told them, they want that ICD-10, whether they think they do or they don't, because it gives them some sense of security knowing I have this. But when you mention mold, that's such an abstract thing for that, and what do you do about it? It's not as commonplace as diabetes where you take insulin or
right. Okay, we're rolling out of this segment. We went a little bit over. This is Ultra Life Today. I'm Josh Bellieu, hanging out with Tiffany Richey, nurse practitioner, and
Adam Payne over here. Thanks for joining us.